This is going to sound a little corny and cliche, but headaches really are a pain, and in many, many ways, and not just from the old cliche of not tonight, dear, but it can affect a lot of things, including your attitude and your level of focus and how you live your life in a positive manner. However, we have a great place out here in the Santa Clarita Valley, the Valencia Headache and Sleep Treatment Center, here to talk about headaches and treatments and more is Dr. Dean Schweitzer. Good morning.
Good morning. How you doing?
Great. Now
Good.
let's get into this. So you actually have a background in dentistry, but we were talking off the air about how many dental problems actually cause headaches. But more importantly, you have the in your sleep center, Valencia Headache and Sleep Center, you actually have the way to define the source of the headaches and also how to treat them.
Yes, absolutely. I've been practicing pediatric dentistry here in Santa Clarita for 36 years. Most of my patients know me as Dr. Dean. But we also have an adult practice as part of our practice, and in that practice, we've been treating patients with chronic migraine, headache, jaw pain, and destructive tooth grinding. And we find that, and medical research has backed us up on this, that most people's headaches and tooth grinding comes from an imbalance in the dental foundation, which consists of our teeth, our muscles, and our joint. And an imbalance in that foundation causes an imbalance in the musculature of the face and the neck, which then results in pain. And we have a way of defining that imbalance by using some pretty cool technology that's digital. And we can measure all the bite forces and very precisely determine where those imbalances are.
So basically, it's kind of like when there's an imbalance, it's like something in that area is putting constant and chronic stress. It's almost like if you were locking up your muscles or something like that constantly, it would eventually cause that sort of thing.
Absolutely. In fact, the best visual I can give you is if you can imagine that you have a pebble in the bottom of your shoe, and every time that you step down, that hurts. So your brain tells you, hey, don't step on that because that's going to hurt. So it directs your muscles to step differently, to walk differently, and until you can get to a point where you can take the pebble out. But while the pebble's in your shoe, your muscles are getting strained and you're walking funny. So just imagine you can never, ever take the pebble out of your shoe. Imagine that it's there permanently. Every time you take a step, it's going to hurt. And the same thing will happen in your bite. When you bite down, if there's an imbalance, your brain says, hey, don't bite there. Try to find another place to bite. So it directs your facial muscles to keep working until they can find a balance point, but they never can. So they're just constantly being overworked and stressed and strained. And that manifests as headache pain, jaw pain, migraine pain, tooth destruction through grinding. And by rehabilitating the musculature and balancing the bite, we can solve all those problems.
When we talk about rehabilitation and balance, are we talking about surgical options, or are there all kinds of difference, or what are we?
There's no surgical treatment here. There's no medication. There's no injection. This is a very, very non-invasive treatment, which is the beautiful part about it.
That is probably about anybody who's suffers from migraines listening right now is going, I'm liking this already.
Absolutely, because most people who suffer from headache pain, chronic pain, have been doing so for a while, and they've sought out help from many different types of providers, neurologists, chiropractors, physical therapists, acupuncturists, and all of those providers have excellent ways of managing pain. But we actually get to the source of the pain and then solve the pain by removing the source.
And you also talk about in ear ringing and vertigo, things that are those also imbalances as well?
Absolutely. In some cases, vertigo, which is dizziness, and ringing in the ears can be a result of facial muscle imbalance.
Interesting. So what's the best way if someone is wanting to get in touch with you to find out this awesome non-invasive way of treatment? How would they best be able to get in touch with Dr. Dean Schweitzer from the Valencia Headache and Sleep Treatment
Center? Absolutely. You can call our office for sure at 287-9667. It's area code 661. Or you can visit our website at valenciaheadachecare.com. And there's a whole bunch of information on the website that will help you understand why it is that what we do is extremely successful.
And that's good, especially the non-medication part, because a lot of people, that's treating the symptom without really getting to the source. And of course, we know what kind of problems that can lead to down the road. So I think a lot of people would be very interested in finding out and not having to be having to take that type of medication if there's a way around that. Dr. Dean Schweitzer, Valencia Headache and Sleep Treatment Center, thank you so much for stopping by by. This is very insightful.
Very much. We're so happy to be able to help people, and I really appreciate the opportunity to come talk to you this morning. Thank you.